Hi, I'm Dr. Stephanie Young Moss, and today I will discuss with you the effects of health inequities on overall health and wellness. Many people don't realize that health inequities can actually affect a person's overall health and wellness and their health outcomes. So today we will discuss the many aspects of health inequities, health disparities, and also social determinants of health. So let's get started with some of the information. First, I would like to tell you just a little bit about myself before we get started. I'm a licensed pharmacist and a researcher, and I'm also a certified health and nutrition life coach. My mission is to decrease health disparities by providing families across the world with practical wellness tips that are both attainable and sustainable. So, back to inequities in health and wellness and how it affects your overall health and wellness. So, first, let's start with a quote from Dr. Martin Luther King Jr. His quote is: "Of all forms of inequality, injustice in healthcare is the most shocking and inhumane." At this time, Dr. King was referring to the inequitable healthcare of people of color in the United States. Not only were these injustices civil, but they were also seen in the healthcare field as well. Now, let's discuss the differences between equality and equity. These two words are often used interchangeably, but they are not the same. The definition of equality is giving everyone the same thing, no matter what the circumstances of their economic level or educational level. While equity means giving people what they need in order to reach their best health possible. Here's an example of equality versus equity. On the left, you will see that everyone is given the same box, which makes their help and assistance equal. But the only person that can actually reach their goal of getting the apple is the tallest person. On the right, this is an example of equity. You will see that everyone is given a box that they need to reach their goal of getting the apple. So, with equity, we are giving people what they need in order to reach their goals. So, what is health equity? Health equity means that everyone has a fair and just opportunity to be as healthy as possible. This requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness, lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. How does health disparities relate to health equity? Health disparities refer to the differences in outcomes or disease burden between groups. Lack of health equity is what caused those differences. A health disparity refers to a higher burden of illness, injury, disability, or mortality experienced by one group relative to another. A healthcare disparity typically refers to differences between groups in health insurance coverage, access to, and the use of care and quality care. Disparities occur across many dimensions. Here are some of those examples. It can be race and ethnicity, socioeconomic status, age, the location of where they live, their gender, disability status, and also sexual orientation. Now, health disparities in healthcare, they not only affect the group being affected by the disparity, but it also affects the overall healthcare system. This is by showing an increased costs, and it also limits gains in quality care for all. Now we will discuss inequalities in healthcare disparities. Inequalities and healthcare disparities. First, we will discuss some of the cost disparities, and then also it's also more than just cost. That's not the only consequence. And then we will talk about how COVID brought health disparities to the attention of many. Health disparities account for $35 billion in excess expenditures each year. That's a lot of money when it comes to how something that's very preventable. But it is about much more than just finances. Some of the consequences when it comes to health disparities is that $200 billion it costs $200 billion in premature deaths as well. This means that someone's death could have been prevented from healthcare disparities. And this is how much it costs from those people who died earlier due to health disparities. Now, there is no secret that health disparities is very prevalent in communities of color. COVID-19 was no different. Here you will see that American Indians, Asians, Black and Hispanic communities have greater incidence of cases and hospitalization and deaths as compared to white non-Hispanic persons. So COVID-19, although we knew about healthcare disparities and health disparities, COVID-19 actually brought these disparities to the forefront where people could really see how it was affecting the community and communities of color. Now let's talk about social determinants of health, or SDOH, and health disparities. Now, what are social determinants of health? Social determinants of health are conditions in their environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risk. Here's an example of a few social determinants of health. Many of these social determinants of health can be broken out into many different areas. Some of the examples are economic stability, social context, environment, education, and healthcare system. So let's discuss a few of those. When it comes to economic stability, income can impact many things. It can impact educational advancement, healthcare affordability, and how much someone is, if they can spend money or if they can afford their healthcare, housing insecurity, where they live, it's safe. Do they have clean water? And access to nutritious food, which of course is very important. So let's go a little bit more into detail about access to nutritious food. So for food security, this affects a patient's ability to manage a chronic illness. If they do not have the proper food to eat, they will not be able to manage their disease or their sickness, which can cause them either to develop more chronic diseases or to exacerbate the diseases that they have. It can also cause them to be non-adherent to any dietary plan that they may have been given in order to alleviate some of those diseases. So food insecurity is a very important social determinant of health under economic stability that can be changed to help overall wellness by helping patients have nutritious food that can help them prevent disease and to have a better overall health in life. Next, for social context. These social contexts are things such as, does a person have a support system? Do they have someone there that they can count on if they need something, or if they need someone to watch their children or to help them go to work? Do they even have emotional support as well? Also, community engagement. Are they involved with their community? Is the community involved with the people within that community as well? Are they helping them? Are they able to rely on each other? How engaged are you with your community? Many people don't realize how important that is, but that sense of community can help your overall health and wellness. And of course, stress. Stress can be very detrimental when it comes to overall health and wellness. Stress can cause many things upon the body that people don't realize. It can cause mental stress, but stress can also affect your body, as far as being tired, as far as creating a atmosphere for disease. So it's important to keep stress down. And we know that if you're not in a good environment, or if you don't have a great support system, a lot of times you can have more stress. And then discrimination. Discrimination can also cause a lot of stress on an individual. Are they being discriminated on in their workplace, in their day-to-day life? Are they being discriminated on even when they go to visit the doctor's office? So when it comes to discrimination and bias, attitudes or perceptions of a certain race can affect the behavior towards and the treatment given to people of color. While diversity of healthcare workers is increasing, it is not the same rate as diversity in the population. It has been shown that physicians or healthcare workers of color actually spend more time with patients who look like them. Now, this doesn't mean that everyone has to have a healthcare worker that looks like them, but it does help if you can relate to your healthcare professional. So what this means is if you work in a community that is either a community of color, you need to have someone there that can relate to them, or that has taken some sort of classes to help them have to be able to relate to, and to also have competency when it comes to their patients. And we're going to talk about that a little bit further in advance as well. Neighborhood and environment is very important. Maslow's hierarchy of needs says that if someone is worried about where they live, or if they have housing security, that's the most important thing to them. They won't be worried about chronic illness or their disease or their overall wellness if they don't have that housing security. Their first and basic need needs to be met before they can think about anything else. So if a person does not live in a great neighborhood or environment, this is shown to cause prevalent chronic illness. But it's more than just having a house or having secure housing. It's also about having safety. Is your neighborhood safe? Do you have parks where you can go play, where kids can run and exercise? Do you have transportation, whether it's public transportation that's reliable and that can get you from place to place, or do you have your own transportation? All of those things really play into the factors if you can get to your job for the economic stability piece, or if you can get to your doctor for the health piece or for access piece. And also crime and violence, which can lead back to stress, as we discussed earlier. So your neighborhood and your environment is more about your housing, but it's also about the things in your community and how safe you feel, and if you have things that you need within your community to support your overall health and wellness. When it comes to healthcare access, a lack of specialties and clinics due to income and neighborhoods can cause a lack of access, which we sort of talked about earlier. Some neighborhoods, they don't have access to great health care. So it's important for us to put clinics and physicians and specialties into those neighborhoods that are quality care and that can relate to their community that they live and work in or that they work in. It's important because they will be able to trust those healthcare professionals, and also the healthcare professionals will build a relationship with their community, which will cause them to want to seek out care or seek out clinics and have that great care that they need. So lack of access is a very, very important part of healthcare disparities and inequalities. Education. This is the most important modifiable social determinant of health. This is something that can be changed by obtaining education. So it's very important to make sure that with education, that people are able to get the education they need to have that economic stability. You can also it helps with the increase in healthy behaviors. It can improve health outcomes with education. It also touches on language and literacy. Both of those are very important for overall health and wellness. If you're in a neighborhood and the person cannot speak your language, if you go to a clinic and they can't speak your language, how can you communicate to them about your overall health and wellness? So it's important that you have also someone there that can relate to them for language as well. And of course, literacy is important as part of education as well. It has been found that people who have greater or more education, they also have better access to healthcare as well. And this could be because they have more abilities to get better jobs, which helps with that economic stability piece. And if they have economic stability, then they will possibly also have benefits and healthcare benefits, which helps increase your access. As I just said, for insurance, having access to preventative medicine can be caused by unaffordability of healthcare and working fewer jobs where healthcare coverage is an option. So that's why the education and the economic portion is so important. It has been shown that in some communities of color and also lower income communities, so not just communities of color, if they do not have the jobs to be able to get them insurance or those benefits, this will affect their overall wellness because they don't have that coverage and they cannot afford their health care. Healthcare system. Of course, we just talked about health coverage and how important it is for you to be able to have health coverage. This also increases and helps with quality of care and also helps with provider access. So all of these things are connected when it comes to healthcare system, overall health and wellness. And earlier we talked about cultural competency. Cultural competency is important because you need to have individuals that work in clinics and that work in hospitals that are able to understand the culture of the people in that neighborhood. So if you don't have anyone in the hospitals or clinics that are of the culture in the neighborhood that you work in, then it is important to have education and training for those people as well, so that they can relate to their patients. This will help them listen to them more, be able to treat them better, and to be able to increase and help with their overall health and wellness. So the cultural competency, communication with physicians presents a problem for 1 in 5 Americans that receive health care, and the percentage rises to 27% among Asian Americans and 33% among Hispanic Americans. So cultural competency is very important when it comes to being able to relate to your physician, communicate to your healthcare workers and providers so that you can help and increase that overall health and wellness. Now, where are we with the current state of health and health disparities? While there has been some public health improvements, there is still a lot of work to be done. Many disparities have either persisted or they have increased in communities of color. So while some of the disparities are decreasing, you will see some disparities, such as maternal mortality, where a mother may die when she is having a baby. You will see that disparities actually increase in communities of color, and that was not dependent on whether they were if they had an education or not. It was just across the board. So some disparities have gotten better, but there is a lot of work to be done with other disparities. Now, one way that the government has tried to help with decreasing healthcare disparities is by introducing the Affordable Care Act. So the Affordable Care Act was a way that the government tried to provide access for Americans who do not have access to healthcare. And they will hope that it will have an impact on public health and health disparities. And in recent times, you'll also see that there have been many health policies and organizations and groups that are making differences in the way that we treat and help health disparities. So while there's a lot of work has been done, there's still a lot of work to do. Now, what can you do to help decrease health disparities? One way would be to make sure that we have diversity in healthcare. This may be by either mentoring someone or introducing health and diversity into communities of color, and also introducing them to the field of medicine. You can also volunteer. You can donate to organizations who have either a mission or a goal to decrease healthcare disparities. And we must also advocate for all to have equal access to healthcare. These are just some of the ways that you can play a part in helping decrease health disparities. So I hope that today you learned how inequalities in healthcare and healthcare disparities affect individuals' overall wellness and health. So it's up to us to work together to help decrease health disparities and decrease healthcare inequalities. My name is Dr. Stephanie Young Moss, and thank you for your time today. If you have any questions, please feel free to contact me at hello@drstephanieyomo.com. Thank you so much and have a great day.